Hello friends, today we are going to discuss about the types of joints of our human body. So firstly there is three types of joints. Firstly the fibrous joint, fibrous joint. Second is the cartilaginous joint, and third is the synovial joint, and I gave a simple mnemonics, that is the SAD. So this is the SAD, SAD. So S for synarthrosis, A for amphiarthrosis, and D for diarthrosis. Okay, so firstly we are going to discuss about the fibrous joint. So firstly fibrous joint is simple if it is a bone, and this is the bone. So just this is the joint. Okay, bone to bone. So this is bone to bone. What are the examples? Firstly the examples are the skull bones, that is the skull sutures, that is the parietal bone, frontoparietal bone, that is the skull sutures are the fibrous joint, and obviously these are immobile. Okay, next is the syndesmosis. What is the syndesmosis? Suppose in case of upper limb and lower limb, if we go for upper limb, okay, so this is the radius, and this is the ulna. So this is the syndesmosis. Okay, so what are the examples? That is, it is firstly this is the interosseous membrane, and the examples are firstly the middle radio ulnar joint, middle tibio-fibular joint, and the inferior tibio-fibular joint. Okay, so these are the syndesmosis, and next is the syndialysis, and this is the between vomer and rostrum of sphenoid. Okay, and the gomphosis, that is the gum teeth joint. Okay, and the ultimately the first sternocostal joint. Okay, so this is about the fibrous joints. Next I am going to the cartilaginous joint. cartilaginous joint. It is of two types. Firstly, the primary cartilaginous joint and the secondary cartilaginous joint. Okay, what is the difference? In case of primary, there is this is the bone, this is the bone. So I denoted as B, bone, and in between there is a these are the hyaline cartilage. Okay, so we can see it bone, hyaline cartilage, and bone. In case of secondary, there is slight difference. That is, firstly, this is the bone, this is the bone, this is the hyaline cartilage, this is the hyaline cartilage, and this is the fibrous cartilage. So this is bone, hyaline cartilage, fibrous cartilage, hyaline cartilage, bone. Okay, and what are the examples? In case of primary, it is called as syndesmosis, and it is the secondary is called as symphysis. Just remember, in case of secondary, it is always present in the central line of the body. That is, suppose in case of center, this is, we know, this is the manubrium, this is the body, and this is the giphisternum. So in case of secondary, the examples are manubrio, sternal joint, Giffy, sternal joint, intervertebral disc, symphysis pubis, and symphysis mentae. In case of synchondrosis, the examples are first chondro sternal joint, and the costochondral joint. And I think many one find it difficulty the names, that chondrosternal, costochondral. So just for secure information, suppose this is the manubrium and this is, so if this is the rib, suppose this is the rib is coming and this will attach here, so this is the rib. Okay, and this is the chondral part. Okay, so this is the chondral part, and this is the costal disc, so this is the costal part. So you can easily now say this is the costochondral joint. Okay, and this is the sternocostal joint. Okay, and obviously this costal part of the vertebral tube is posteriorly attached to the transverse process, and the of the vertebra, okay, and the body part of the vertebra, okay. And the next is the synovial joint. And what is synovial joint? Obviously same thing, like this is the bone and this is the hyaline cartilage, and here it is another bone, this is the hyaline cartilage, and this is the synovial fluid. And the examples are, firstly the plain, number 1, plain synovial joint. So just I want to tell you that here we have already find there is a middle tibiofibular and inferior tibiofibular. So just superior tibiofibular is left. So just add here, that is the superior tibiofibular joint, and costovertebral, that is the costal part posteriorly attached to the vertebral body, okay. This is the costovertebral joint, and costotransverse joint, okay. Cricothyroid joint, cricoarytenoid joint, okay. Intercarpal joint, intermetacarpal joint, acromioclavicular joint, carpometacarpal joint, except the first one, okay. Next we are going to the pivot, and we have already talked, there is the tibiofibular, so left is the superior radioulnar and inferior radioulnar. So superior radioulnar joint, inferior radioulnar joint, and atlantoaxial joint. Next is the third is the hinge joint, and for this my mnemonic is hip. So E for elbow joint, A for ankle joint, and P for interphalangeal joint. Okay. Fourth is the condylar joint, and here the mnemonic is C K T. So K for knee joint, T for temporomandibular joint, okay. Fifth is ellipsoid joint, and here is the firstly the remaining like wrist joint, metacarpophalangeal joint, atlanto-occipital joint, okay. Sixth is ball and socket joint, ball and socket, and I think many of you know the mnemonics, that is the this. Here the T for tallo, calcaneo, navicular joint, H for hip joint, I for incudo, stapedial joint, S for shoulder joint. Okay, and the last one is the saddle joint. And I already told that the first carpometacarpal joint is not the example of plain synovial joint. So in case of saddle, this is first ligament, first carpometacarpal joint. Okay, next is the sternoclavicular joint, calcaneo cuboid joint, patellofemoral joint. So this is all about the topic of types of joint. So thank you friends.